Reefer Madness is back, y'all. This time it's just a little less racist and attempting to be more scientific. In this video, I'm going to be calling it out and showing you why it's total BS. Hit the intro, eh? What the f*** is going on, YouTube? It's Ashcon, aka Dropped Out Beats, back again with another reaction video. If it's your first time tuning into the channel, I am trained as an addiction neuroscientist, and I work professionally as a science communicator in neuroscience. And today we're going to be talking about Reefer Madness and how I feel like Reefer Madness is back because of all the disinformation I see being spread about cannabis that doesn't focus really on the science of drug use and drug addiction. And that's what we're focused on this channel. So if that sounds interesting to you, hit the subscribe, hit the like. We talk about drugs and how most of what you hear is just straight up fear-mongering propaganda. With that being said, let me take my Blue's Clues looking ass off the screen, or rather make myself small and make this screen, this ugly guy, bigger. You know what I'm talking about here. The reason I'm making this video is because I saw this video by Dr. Joseph, who is supposedly a psychiatrist, who made this video titled, "Cannabis is More Dangerous Than You Think." And so I started watching it because I was like, I have a feeling I know what he's going to say. Because if you even read the description, it says, cannabis today isn't the same as it was 20 years ago. Boomer take. With THC levels skyrocketing, more people are experiencing boomer problems. I mean, most likely he's talking about cannabis-induced psychosis. And so, let me make myself big again because, I mean, that guy's kind of ugly, you know what I'm saying? I'm better looking in my Blue's Clues shirt than that guy. So, basically what he's talking about, and he interviews a patient, and he says, you know, oh my gosh, with THC levels skyrocketing, I'm seeing so much more cannabis-induced psychosis in my office. I'm treating so many more patients with cannabis-induced psychosis. And I'm not disagreeing with him in terms of that he might be seeing it more. If he lives in a cannabis legal state where there are now more people using cannabis, he may in fact be seeing more instances of cannabis use leading to a psychotic episode. But that does not mean you should be making disinformation videos where you talk about how you don't think cannabis use or cannabis should be legal. And so that's really what I'm here for, is to kind of call out the propaganda and what I see as propaganda. Because when a lot of psychiatrists, and I've worked professionally around psychiatrists, I hear what they say every day about drugs and cannabis in particular. And so a lot of them who are unfair to cannabis and have an obvious bias talk about a cannabis-induced psychosis episode much differently from how we understand a methamphetamine-induced psychosis episode. And so let me go over here. And so when you hear doctors talk about a methamphetamine-induced psychosis episode, it's very specific in the sense that methamphetamine-induced psychosis is transient, meaning it lasts for a period of days and then it goes away assuming you stop using the drug. Let's look at this book chapter that eloquently explains it. Let me see if I can't zoom in here for you beautiful degenerates learning about drugs with me. Whoa! What the fuck? Zoomed in way too far there. My bad. All right. So let's read this. Methamphetamine-induced psychosis. Methamphetamine can induce a transient psychotic state that is characterized by hallucinations and persecutory ideation. Less common manifestations of methamphetamine psychosis include stereotyped repetitive behavior, punding, disorganized speech, and illogical tangential thoughts. Symptoms typically last only hours, and even in severe cases, usually abate within a week of withdrawal from the drug. A minority of users experience a more prolonged symptom pattern that resembles schizophrenia, although it is often argued that this protracted form of methamphetamine psychosis would be more accurately described as a precipitation of schizophrenia in vulnerable individuals. And so this is critical to understand because what we're saying here is that methamphetamine, very specifically at high doses over a long period of use, can induce psychotic states. And so when you stop using the drug, we're going to decrease that psychosis. We're going to start turning it down. We're going to start turning it off, because the person does not necessarily have a brain that produces schizophrenia, right? It is just a state of the drug, and therefore is transient and goes away. I have a full video here where I talk about the neurobiology of a methamphetamine-induced psychosis state after Fergie talks about seeing these like dancing ninjas that are coming after her. It's kind of interesting. Go check it out. Anyway, this is different from how doctors, psychiatrists talk, or professionals in mental health talk about cannabis-induced psychosis, because the way that they talk about cannabis-induced psychosis is that it is this protracted thing that lasts forever. It is not cannabis-induced psychosis, it is cannabis-induced schizophrenia. And as we see here, for methamphetamine, they leave the nuance that for some individuals that have protracted, meaning long-term psychosis symptoms, they just might have a diagnosis of schizophrenia, and the methamphetamine use uncovered that schizophrenia. And so that's totally reasonable. Some of these drugs, they work on these neural pathways that are involved in schizophrenia, and so therefore using the drug can uncover that schizophrenia. And so, in vulnerable individuals, I would never recommend using methamphetamine, cannabis, psychedelics, any of these drugs, because we could uncover schizophrenia. Now that brings us to the problem of who is a vulnerable individual. We don't know. We do know that younger drug use might uncover the schizophrenia earlier, but that does not mean it causes the schizophrenia earlier. And so that's a big distinction that we need to understand, and we need to give leeway to, and we don't need to believe the propaganda that, all of this high THC is causing schizophrenia. And so the reason it's particularly important to compare to methamphetamine is because methamphetamine is the brother of amphetamine, which psychiatrists and doctors prescribe in the form of Adderall, right? We have a variety of different types of amphetamines that can induce amphetamine-induced psychosis that are the same transient psychotic-like states that methamphetamine induces. And so what I want to do is compare the way that psychiatrists kind of talk about cannabis-induced psychosis, where it's this thing that lasts forever, and it's cannabis-induced schizophrenia, versus cannabis-induced psychosis, and see what how the research talks about both, versus what the message from psychiatrists, law enforcement, doctors is. So first, let me slide over to this PDF. And so this is a science article from the JAMA of Neurology titled Stimulant, Medication Use, and Risk of Psychotic Experiences. All links to the science and citations will be in the references below, in the description below, because this is a real science channel, unlike these other people that just talk out their ass about science and then never have any citations or references in the damn description. This is a real science channel. Check the references below for yourself if you don't believe me. Anyway, we're talking about stimulant medication use and the risk of stimulant medications prescribed by doctors inducing a psychosis-like state. So if we zoom in here, basically this is a huge meta-analysis called a target trial emulation framework. We'll get to that target trial emulation framework in just a second, but basically they use this target trial emulation framework, this fancy statistical design, because of previous research implicating amphetamines in psychosis states. And so again, these researchers are doing a big meta-analysis based on previous research. And so one of the previous studies that they talk about in this study, when they're talking about their previous studies that they're basing their study on, is they say one comprehensive observational study found a strong relationship between stimulant prescription and psychotic experiences, even after including multiple potentially confounding covariates in their analyses. In a study of 141 individuals, researchers found that 65% of young people with ADHD who had been prescribed stimulants reported psychotic experiences, compared with 25% of young people with ADHD who were not prescribed stimulants. The authors concluded that psychotic symptoms may be relatively common adverse effects of stimulants in use with a family history of major psychiatric disorders, and argued for careful monitoring of this relationship. So here we see that in one of these previous studies that motivated these researchers to conduct the study we're about to look into, 65% of young people reported having an amphetamine-induced psychosis experience, meaning they were prescribed an amphetamine from their doctor and then had a psychosis or an amphetamine-induced psychosis state that went away once they stopped taking the drug. What the researchers further found out through their statistical analyses was these were individuals who were vulnerable to developing psychosis or schizophrenia because they have a family history of family members developing schizophrenia. And so that tells you right there that there's more to the story, right? There's some nuance that we need to look into of why are these, medications that are proven safe and effective possibly causing or leading to amphetamine-induced psychosis states. And so what I want to be clear about is I'm not saying that amphetamines prescribed by doctors cause psychosis states. That's generally not what happens. Only in individuals who are vulnerable to schizophrenia, right? When you're prescribed an amphetamine and you take it to the way that you're intended to take it via your prescription, the likelihood of you developing an amphetamine-induced psychosis state is very low. So let's get into that. Remember, this study had 141 individuals. That's really not shit. That's not shit compared to what this study is about to look at. Remember, that's a previous study. Now we're looking into the good stuff. And so, like I said, this is a target trial emulation framework that they're about to use. If you're more into the science and the statistics, I recommend checking out this target trial emulation framework paper from the JAMA Guide to Statistics and Methods. Basically, a target trial framework allows us to determine the cause of something. It's the best statistical model that we have right now to determine what the cause of something was by throwing in a bunch of different variables and testing those variables to see how they predict what the variable is that we're interested in. Okay, so remember when I said that the study that motivated these researchers to conduct this meta-analysis had 141 people and that wasn't shit? Here's my point. In this study, the study that we're interested in, there was 8,391 individuals. Okay, that's a lot more than 141. And then remember, we're looking for the potential cause, right? Here we can use fancy statistics to determine the potential cause of something. So what they say is a total of 18.9% of all participants reported one or more psychotic experience of at least moderate distress at time zero, aka when they entered the study. The prevalence of each individual psychotic experience item in the PQB at time zero is detailed. A range of psychotic experiences included in the PQB were endorsed by participants, the most common being paranoid ideas, auditory hallucinations, and perceiving a supernatural presence. At 1 year follow-up, 15.1% of participants reported one or more psychotic experiences of at least moderate distress. There were 460 individuals who had received a first stimulant prescription by 1 year follow-up, as reported by a caregiver. Individuals who were prescribed stimulants were more likely to be male and had higher scores on psychopathology measures indicated at time zero. Okay. So, when we see that, we think, damn, that's a really high number of people reporting a psychotic experience after having been prescribed a amphetamine. But again, once we start really applying different variables and looking at these individuals' family history, we can start to determine, do amphetamines cause psychosis, or are these individuals who have psychosis more likely to have, are these individuals with ADHD more likely to have psychosis? And that seems to be the case. So they say here, our findings suggest that shared characteristics associated with psychotic experiences and the likelihood to be treated for ADHD may drive the association between stimulants and psychotic experiences, which is what I was just saying, rather than stimulants playing a causal role. So, in other words, doctors have no problem prescribing amphetamines, which we know neurobiologically can cause an amphetamine-induced psychosis, but that will go away assuming you stop taking the drug. But when it comes to cannabis, they make it so much worse, and they treat it like cannabis-induced schizophrenia. And so I've seen a lot of this, right? Like, I work professionally in psychiatry, and then I see this from Marijuana Moment, which obviously they're biased towards the legalization of cannabis. But they were talking about the DEA promoting a claim that marijuana could be more likely to cause psychosis than meth. And so you can read through this article yourself. But there was basically a PR press release from the DEA in an email blast, basically raising the question, is meth or cannabis more likely to cause psychosis? And so when I see the way that doctors talk about it, I think it's a little irresponsible because they allow for so much nuance in the drugs that they prescribe being amphetamines, but not in the recreational drugs that people are put in jail for. And then what they say is, we need to keep things illegal and then keep these people in jail. That's just causing more mental health damage and more trauma to people's mental health, which then increases the likelihood they could develop a psychosis-like state or a psychosis experience. And so hopefully you see what I'm trying to get across in this video. Don't fall for the propaganda. We're in a reefer madness state where people are talking about, how likely cannabis is to cause psychosis. But so what does the research say about cannabis-induced psychosis, right? Like, what research do we have looking into cannabis-induced psychosis? And so I found this recent meta-analysis, which it will be linked down in the description below, titled Assessing Rates and Predictors of Cannabis-Associated... Hold up, let me make myself small again. Assessing Rates and Predictors of Cannabis-Associated Psychotic Symptoms Across Observational, Experimental, and Medicinal Research. And so you can read this yourself, but basically when we get down here to the discussion, what they find is that a number of factors can predict a cannabis-induced psychosis episode, one of them being a family history of schizophrenia. But it seems like 1 in about 200 cannabis users experience a cannabis-induced psychosis episode, which is considerably less than the 141 individuals that were in the initial observational study that motivated the meta-analysis we were just looking at in the target trial framework amphetamine study. And so you can really kind of see the nuance here of how the medical community talks about recreational drugs and how dangerous they are versus how dangerous the drugs that they prescribe are. And so that's what we're here for, is to play referee. I don't know that either of these drugs really lead to the development of schizophrenia. I think if you are going to develop schizophrenia, it's a combination of environmental factors, being, did you grow up in a traumatic home? Were you abused? Were you neglected? Did you not have enough money to eat? And then genetics. You can't help your genetics. If your grandpa develops schizophrenia, then you're more likely to develop schizophrenia, and that should lead you to not use drugs like methamphetamine, cannabis, whatever. I don't think it's that difficult to understand. I don't think we need to make YouTube videos scaring people about cannabis-induced psychosis or amphetamine-induced psychosis for that matter. Instead, we need to learn how to safely use the drugs the way that doctors prescribe them, right? Like, why is a doctor able to prescribe a drug and it's used safely? That's what we're getting at on this channel. And so if that interests you, hit the like, hit the subscribe. Down below in the comments if you have something for me to react to. I appreciate you being here today, you beautiful degenerate.
Turn on, tune in, and drop out, drop out, drop out.
That's the video for today. Peace out.
Together and experience together how to reach the 5 levels of consciousness which are available to a species like ours.
Drop out, drop out, drop out.